Hi, my name is Dara. I was asked to make this video by a friend of mine who thought it would help parents who are going through the same thing that we went through to help them find a little bit of comfort in the diagnosis that their child receives. So the story is my daughter was diagnosed with tetralogy of Fallot, more specifically double outlet right ventricle with pulmonary stenosis and pulmonary insufficiency. She was also diagnosed with cranial cystinosis, which is a different part of the diagnosis, and I'll go over that as well. But anyway, they initially thought that she had Jacobson's syndrome, but I'll go over that too. So when I was pregnant, we thought everything was fine. There was no issues with the pregnancy. It was actually the easiest pregnancy I've had. She's my third child. I had pretty much no symptoms the entire pregnancy. They kept saying that I was bigger for a gestational age, even though I felt like I was smaller than my boys. And so that led to a diagnosis of gestational diabetes. And they kept saying that, oh, she's so big, she's so big. Well, on her growth ultrasound a few months before her birth, she was tiny. She had a bigger head, they said, but she was tiny. And so everything seemed to be fine. She failed her first heart test in the hospital, and I was reassured that it's no big deal because that is a normal thing, and they just have to redo it because the babies are under an extraordinary amount of stress. And usually when they redo it, everything is fine. So they redid it, and everything they said was fine. When she was born, her head was shaped a little bit different. It almost, if you look down at it, it almost looks like a egg or an almond shape. And they called a specialist in right away, and the specialist had no bedside manner whatsoever. And here I am alone because my husband had gone to do something. I don't remember. My hormones are raging, and he comes in and says, I think your daughter is going to have her skull broken, and she's going to have surgery. And I just looked at him and said, excuse me? You've got to be kidding me. What are you talking about? My baby is less than 24 hours old, and you're telling me this. And so anyway, I just kind of blew off what he said. Obviously, I'm a nurse, and so obviously I kept it on the back burner of my brain, but at that moment in time, I was not in any emotional state to be handling that type of information. So we took her home. We followed up with the doctor a few days later, both at the midwife clinic with the lactation specialist and with her PCP, and everything seemed to be fine. On her 1 month appointment, the doctor said that she thinks she hears a murmur and that she's going to refer us to Children's Hospital. And so, of course, I'm doing all this research and everything. And I talked to a ton of people at church, and they kept telling me, oh, it's okay. My kid had a heart murmur growing up, and they just grew out of it. It was something, minor. And so I kept this on, the back of my brain, but, thought everything was fine. So I went to the appointment alone. And this was my first mistake, and this is going to be my first tip to parents. Do not go to these appointments alone because you do not know what kind of news or diagnoses or information you're going to hear, and it helps immensely to have that emotional support. Because I did go alone because I was expecting it was going to be no big deal. When we went in to do the echo, the doctor didn't mince his words at all. He just looked at me and he said she needs surgery. And I need to be able to finish the echo to decide how extensive the problem is. But I just want you to know that this is something very serious, and we're going to be taking more in-depth pictures. So, of course, I just kind of looked at him with a deer in the headlights look, um, and started crying because here I am thinking I have this normal, healthy baby girl, and I don't. And so he wanted to make sure that I was okay, and they were really great about that. And I told him, I said, yeah, it's just a lot of information to process. They finished the echo. That was when she was diagnosed with a tetralogy-like Fallot diagnosis of double outlet right ventricle, which basically means if you know anything about the heart, I can try and draw a picture. Sorry. So basically, your heart is shaped like a football almost. And you have 4 chambers of the heart. So I like to draw it like this because it's easy for my patients to understand. Okay. So this is your 4 chambers of the heart. In fetal circulation, you have a hole here and a hole here. I'm not going to go into the technical, to do of everything that goes on. But basically, the blood goes into one side of the heart and out the other. So this hole is very large. She has a large VSD, and she also had an ASD. So these are the atria, ASD, atrial septal defect, VSD, ventricle septal defect. Also, instead of her heart looking like this, her heart looks more like this. So the larger side is on the right side of her heart, and the smaller side is on the left. The problem with that is it creates a whole issue of the heart having to work harder, because the blood's not going where it needs to go, because your body needs to get the oxygen where it needs to go. So anyway, so she has the ASD. I'm just going to review her diagnosis. She has the ASD. She has the VSD, which are 2 holes in her heart that normally should have closed up a couple days to weeks after birth. She has the double outlet right ventricle. So instead of the, the artery comes in here and goes out here, kind of, oh, my pen's not working, into here and into here like this, both of these vessels are going into the one side of her heart. That's why they call it double outlet. So, and that's very, very in a nutshell. So those are the things that needed to be fixed as well. Her pulmonary valve was also not functioning, and the pulmonary artery was stenosed, which means it's narrowed, and it's causing the heart to have to work really hard to squeeze that blood into the lungs where it needs to go. So we got all this diagnoses, and I took the picture home and to show my husband, and I have to say this is the second tip. If you do not have somebody who is a strong support at home, you need to find someone. Doing it on your own and I'm sorry if I get tearful, doing it on your own is thinking you can handle this on your own is a mistake. It does not matter how strong you are. I am a strong woman. I was a single mom for a long time of 2 boys that are now 12 and 14. I met an amazing man when they were 2 and 4, and he has been there for me through everything. But this really tested our relationship. And as strong as what our relationship is, there are still going to be the what ifs and the blaming, and it's kind of like a grief cycle almost, and you have to allow yourself to go through that. So anyway, I came home, told my husband, and his response is, okay, what do we need to do? Let's get this done. What do we need to do? What needs to happen to make our baby girl healthy? I also consider myself a woman of faith. I am a Christian. I believe that God has a plan for everything. However, that being said, the first day that I came home, I blamed God. I kept asking why. Why do I have to go through this? Why does my little girl have to go through this? What have we done in our lives that is warrants this. I'm so sorry. I still get emotional after all these months. Um, and so, the first day was pretty bad. The second day, I was pretty numb. I almost in like a depressive state of how am I going to deal with this. The third day, um, I was a hermit. I had my friends texting me, wanting, to talk to me, make sure I'm okay, and I didn't answer any of them. I didn't want to deal with it. Um, the third day, I kind of came out of my funk, and I said, okay, I need to think about this logically. And for me, I used my spirituality to say, okay, I can do this. What needs to be done? So it took me a few days to come to the point of my husband. Some people are not that lucky and do not come to that place. I met a woman in the hospital, and if she watches this, you were amazing to me. You'll know who you are. Um, she did not have a great support system, without going into too much detail. And the other person in her life decided they couldn't deal with the stress and left. And so she is amazingly strong. And she was one of the people that gave me that tip of find someone to lean on at home. And she was awesome. I really appreciated the conversation that we had at the hospital for a few hours. So now back to the story. I'm done with the tips and the pictures. So she ended up having to have open heart surgery. The biggest concern was the VSD because that's the blood flow of the heart, from the left to the right and getting, the blood where it needs to go. So she went out on June 13th at 4 months of age. She had a bigger hole than what they thought. She was on bypass for quite a few hours longer than what they thought. They had a hard time getting her off. She, I do believe, received a blood transfusion, and they were not able to fix the ASD. I originally had thought they said they did, but I guess they did not. They had to take the patch out and make it bigger. It's called a transannular patch to cover the VSD so that kind of your skin can grow around it. They tried to fix the pulmonary stenosis, but they were unable to do so at that time, because they kind of shaved out the muscle to try and make it bigger, but they were not able to make it work 100%, and they could not salvage her pulmonary valve, which means that when she is 7 to 10 years old, when her heart stops growing and it's at its size that it's supposed to be, she will have to have another surgery to fix that. At this moment in time with a pediatric surgery, it is an open heart surgery. However, the technology that they are coming into is amazing. And the surgeon had said, in special cases, they are doing this as a laparoscopic surgery in adults. And so the hope is that by the time she needs it, it will be a laparoscopic surgery for children as well. So they had a really hard time getting her off of her heart medication because she was on bypass for so long. It was really hard to see my baby girl intubated. Again, there's people out there that may not believe the same as I am, and that's fine. I'm just sharing my experience with you to help you understand this. And so part of my experience is the very strong church community that I have. My pastor came up to the hospital to visit us multiple times, which did way more than what I could ever imagine, is support-wise, just helping us to show that, they're behind us no matter what happens, and they care for us and they love us. I had an amazing support system at home with a meal train that was developed by some ladies in our church who brought more than enough food. I have 2 teenage boys, and those boys, let me tell you, they can eat a ton of food. And so they brought enough food to last them for even lunches. And they would take my kids, because it was in the summertime, and they get stir crazy. They're boys. They both have ADHD. They need to get out. They need to play. And multiple people took them fishing. I mean, did tons of stuff. What I'm saying with this experience is when you're going through this, the surgery, you need to be focused on your child. Make arrangements, whatever you can, for the other kids to be away from that. Personally, I did not want my boys to see their baby sister like this. They love her. They think the world of her, and I felt like it would be very detrimental for them to see her intubated and to see her with all these tubes and wires, and that they didn't understand. Even though I am a nurse, and they know about all this stuff because they watched me study through school, and growing up, I feel like I was in school since they were 5 years old. I still felt like it would have been too much for them. I mean, I showed them pictures. They even watched a surgery on YouTube of a similar surgery of what she had, and to prepare them for like her scar and everything. But finding someone to help you, I mean, use outreach. Social media, as much as what I dislike social media as a whole, I think it does a lot of damage. I also think it does a lot of good, because there's a lot of people that you become friends with in different community groups that want to help and that will help you out no matter what it is, whether it be a meal train, whether it be babysitting or transportation for your kids, or to a boys and girls club, or just something. Find something. Family. Rely on family. I unfortunately do not have family out here. My family is all in Michigan. My friends have become my family. My husband's family are amazing, and they helped out a ton as well. And even the text messages and the emails and the letters and the cards and everything that I got all helped go through this time. So back to the surgery. Um, she was in the hospital for 8 days. I actually documented and took pictures of every single day, and every single day you could tell she was getting better and better. And by the, I would say 5th day, 4th day, somewhere around there, besides getting pneumonia, she was sitting up, and she was happy, and she was smiling. Her pain was an issue, so we did have to continue giving her morphine for a little bit so that she would eat, because she had lost quite a bit of weight. But she's a little peanut as it is. I mean, she's presently 9 months old and only 13 pounds. So she's a tiny little thing. But, just to whatever it was to help her get to eat, between Tylenol and morphine, we were able to manage it. And we managed it. I mean, she was probably painful for a few weeks. But any open heart surgery, I mean, they have to cut your chest open. They have to cut all those muscles, and everything hurts and is sore. And so anyway, she's been doing great. She is the most amazingly happy little girl. You would never know, besides seeing her scar, that she had open heart surgery. She is such a joy in our lives. We had to, going back to, they had to do genetic testing on her because they were convinced that she had Jacobson's syndrome, which was a whole other emotional roller coaster, because, Jacobson's syndrome is like autism. It's a very large spectrum. You could have just the physical aspects of it with the cranial stenosis and the heart disease, and a couple other little anatomy things that are going on in her chest. Or you can have full-blown mental disabilities and physical disabilities and everything. So, and it also comes with a blood disorder. And so that is why they had to do the genetic testing, because they wanted to make sure before she underwent the such an extensive surgery that she did not have the blood disorder that is associated with that, because it's makes it so babies can't clot. And so that came back normal. Thank goodness it was normal, but she still did have the cranial cystinosis. So now we can move on to that for briefly. So when you when you're in utero, you have different planes of your head, your skull that are not fused. That way your brain can grow. Usually by around 2 to 3, your planes are finally, or the plates are finally fused. Well, her two frontal bones, so there's a suture, they call it a suture, which is right here. Instead of fusing when they're older, it fused in utero. So that is why her head kind of looks like that. Um, and so she will have to have cranial surgery. They said when she's around a year old, to basically, this sounds really awful, but it really isn't as awful. They cut this here, they peel this back, they pull the frontal bone out, they reshape it and affix it with dissolvable plates and screws, which I think is just an amazing feat. And then they sew everything back up, and within a couple months, you would never know. Um, so that being said, here recently, we went into I apologize if I get emotional again because this is a new thing. We went into her cardiologist appointment at 9 months of age, and they said that unfortunately there are no changes because of the transannular patch. The heart conduction, which is the electricity that goes to the heart that makes the heart kind of pump like this, together, is still interrupted, and so her heart's kind of going. And so the right side of her heart is still dilated, which means it's still enlarged. And he said the hope was that there would be some changing in it getting smaller and more towards the normal size, and the conduction of the heart being more normal and together. All that being said, he did say it's good that there isn't worsening. Everything's just kind of stayed the same. The pressure on the right side of the heart is still the same as it was 3 months ago. And so, that being said, they may have to put off her cranial surgery because the ASD, which was the hole up here, the little hole up here, still has not closed. And so, they may have to put that off because I guess something having to do with that type of surgery, it puts venous air or air into the venous system. So he has to consult with the craniofacial specialist and the neurosurgeon to find out if they're still going to do her cranial surgery at a year of age. Her next echo is scheduled on her birthday, which is February 13th, and they will go from there. If there still is no changes, they have to go in with a heart cath and or MRI to figure out why. An MRI is scary all in itself. I didn't talk about that. So she had an MRI because part of the pathology of Fallot is misplacement or misgrowth. I guess I don't know if that's the correct terminology of the arteries, that the cardiac arteries that feed the heart. And the danger is that when you do the surgery, you could cut them. And so they have to get a full picture. And so they did a sedation MRI, and come to find out she's like her mama, and she comes out of sedation very slowly. It took quite a few hours in recovery for her to come out of sedation, which was very difficult both on me and my husband, especially my husband, because they called him back into the I don't know what it would be called, but basically you go from the sedation MRI to recovery, where you have to come out of sedation, and then you go to another room for further observation for X amount of hours. And they didn't tell him what was going on. And so he sat back there for like 6 hours, which was very difficult. And I think we would do things differently next time. Next time there would be more of a communication, because there isn't really reception in the hospital where you can text or call. So I guess that's another one of my tips, is to be assertive. Make sure that they are letting, because you have a nurse one-to-one with you pretty much, and make sure that that nurse is communicating with, somebody. If they're with you, make sure that they're communicating the information, because I didn't, and that was quite traumatic for my husband. Um, so all that being said, like I said, we try and focus on the fact that she is a very healthy little girl. She appears to be a healthy little girl. She's growing at a slow rate, but she is growing. Um, she's asleep right now, otherwise I would let you guys see her. I will continue with these videos as long as people want them. I will try and figure out, this is new to me, so I will try and figure out how to put my email address on there, or comment, ask questions. I will try and answer them to the best of my knowledge, but I really hope that who's ever watching this finds comfort in this, to know that as scary as what it is and dealing with all of this is so, so very scary. You are not alone, whether it be thousands of miles away or right next door. You're never alone, and please do not be afraid to ask for help. Um, so thank you guys very much for spending the time. And I kind of feel like if I helped one person, then my job is done. So have a great day.